The biggest one I get is the issues around cholesterol. That's probably the biggest one because people are worried about heart disease, which is a valid concern. It's the number one killer, right? And so the question is, a carnivore diet will make your cholesterol go higher. That is true in some instances. And the question is that put you at additional risk for cardiovascular disease? And the answer is...
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Welcome, Dr. Shawn Baker. It's an absolute privilege to have you on with all of your experience and over 10 years, I believe, carnivore diet expertise.
Thanks for having me on. Appreciate it. Yeah, it's fun to chat with you.
I'm hoping that we can delve into what is still quite a controversial topic. It's growing attention and many, many people are following this diet, but we're still getting a great deal of pushback. So first things first, I was wondering, could you clarify the terminology? What is actually a carnivore diet?
Yeah, and that's a great question because there's a lot of people that are kind of have a very loose definition of a carnivore diet, and it can be confusing for people. And I consider a carnivore diet first and foremost a therapeutic treatment protocol for people that are sick. I mean, that's its main utility. Some people turn it into a lifestyle and tattoo carnivore Carl on their forehead, and that's separate stuff. I mean, it's fine if you want to do that too, but from the standpoint of let's talk about how we treat disease with this thing. And so a carnivore diet kind of sounds what it sounds like. I mean, it's not like you're running around and tracking zebras down in the wild and biting them with your teeth, but I mean, it's a diet that focuses on animal-based food. So as you have these whole food plant-based diet, you could call it a whole food animal-based diet. And it centers around and to the point that it excludes essentially all the plant foods, which I know sounds crazy and heretical, but it's meat, it's eggs, it's seafood, it's sometimes dairy products for those that tolerate those. And that's about it. I mean, that's, maybe, obviously drinking, some people will add some coffee or tea in there, and occasionally people use a few spices to make it more interesting. And you'd be surprised how creative with that limited set of foods people can be with people making carnivore breads and carnivore waffles and all, cheese and eggs and things like that. So it's certainly very, very much a restricted diet. And intentionally so, because this is something that people with diseases often need to do that for a period of time. It's by definition very low carb. It can be ketogenic, and often it is, depending upon meal frequency, meal size, protein content, and so on and so forth. It clearly excludes ultra-processed junk food. I mean, there's really no ultra-processed food on a carnivore diet. It is higher in protein than most diets out there. It is something that produces a great deal of satiety for most people. But again, to the strict definition, it doesn't include honey. It doesn't include fruit. It doesn't include vegetables. It doesn't include grain. It doesn't include breads or pastas, any of that stuff. And I know some people would be horrified that there's no vegetables in this diet because they're like, we have to eat vegetables to be healthy. That's what we've been told for certainly decades and perhaps even millennia. We've sort of believed that these vegetables are the key to health. And I would argue that maybe they're not. And the reason I say that is because the results I see on a literally daily basis on people that exclude vegetables from their diet, which sounds, when I first heard about people doing this, 10 or so years ago, I thought they were completely crazy. I thought they were nuts. Mm-hmm. They were crazy. They were going to get scurvy.
Absolutely. I did too.
They're where's all the fiber and all, and it's, as it turns out, at least for a significant percentage of people, excluding those things often results in better health, at least in the short to medium term. Now, I'm not going to make claims about long term, only because there's no way to really test that. There's really, I mean, and that's true for any diet. Let me just be very frank at the beginning here. There are no diet trials, randomized controlled trials, good, strong data that'll show you any diet is better for your health in the long term. Now, certainly there are diets where people get acutely sick. This is a standard Western diet, the standard American diet. I'm sure there's a standard Australian, standard UK diet where people are eating all this ultra-processed junk and they get sick and obese and diabetic. And that's clearly associated with worse health outcomes. But as far as saying this one diet, vegan, carnivore, Mediterranean, paleo, DASH diet, zone diet is going to make you live longer, I would ignore those people completely. And you'll never hear me making claims about carnivore is going to make you live longer or shorter, because we just don't know. We just don't know that. And we will never be able to know that unless we can convince, twins to lock themselves up in a metabolic ward for 50, 60, 70 years and only eat one diet and keep everything else identical. It's just not practical to do that. So I think the best we can do, in my view, as a physician, is to say, can I take a sick person who's sick and suffering and, make a lifestyle adaptation diet, other things, maybe sleep and, exercise, and make them no longer sick anymore. And I can say with a high degree of certainty that, yes, I can do that very reliably.
I'm just coming back to how you define a carnivore diet. And, I feel like there's a lot of nuance and people interpret that in different ways. And my background, I came to nutrition with my children, putting my son on an elimination diet, which was very much inspired by Westo Price and ancestral foods, a lot of broths, a lot of meat, very, very limited, no fruits, definitely not dried fruits, no sugars, and it really, really high in meat. And I wouldn't have thought of that as a high protein diet at the time, but it very much was. I feel like you're quite set on it being a whole food diet. When I first was introduced to the first person I met who termed his diet carnivore diet, and ate a carnivore diet. He was an elite athlete here in Australia, and he was eating every day. He'd buy his food mostly from the garage and Costco, and he was having salamis and meat sticks and crab sticks, a lot of processed foods. And I was wondering how you feel about some people approaching carnivore with a lot of ultra processed products.
Well, I guess we have to define processed food versus ultra processed food. And there is a NOVA classification difference in there. And ultra processed foods tend to be 5 or more ingredients where they've substantially been altered from their original form, and they also have ingredients that you wouldn't find in a normal kitchen. So if it's dried meat with a little bit of sugar and spice or something like that, I would call that processed, maybe not ultra processed. So just to put that fine point on that. But I think that depending on who you're dealing with, like I said, not everybody needs to go carnivore to get healthy. Clearly, you can lose weight lots of ways if you eat a diet that is devoid of ultra processed junk food and you focus on whole food, nutrient-dense food, plants, meat. Many people will do well with that approach. And again, I just happen to know that many people, even if they're eating that way already, they're on this clean diet, they don't have a lot of junk, they're eating vegetables and fruits and meat. Some of those people actually get better when you remove the vegetation from their diet. Believe it or not, it's just the way it is. I'm not, it's not by any kind of sort of ethical belief. It's just what happens when you do that. And I can point to the results of thousands of people now at this point. What was the other point about designing the diet? So, obviously, it's obviously low carb. There's no doubt about it. There's a little bit of carbohydrates in an egg, like a half a gram of carbohydrates in an egg. If you have some dairy products in there, there might be a little more. But for the most part, you're going to be eating a very low carbohydrate diet, arguably even a zero carb diet, depending on how you implement it. And therefore, your energy source has to then come from fat. And so that's why many people that do this diet tend to gravitate toward things like red meat, like, beef, lamb, things that have a little bit more fat on there. Because if you just try to eat a purely high protein, low fat diet with no carbohydrates for energy, you are going to struggle. Modified protein sparing modified fasts can be done in the short term, a few days, maybe a week, but beyond that, forget it. It's not going to last. So most people on a carnivore diet eat a lot of red meat, including myself. I eat probably 95% of my diet is beef. Again, I say it's generally higher in protein than the standard diet. The standard Western diet, standard any diet tends to be 12 to 15, 16% protein. That's by macronutrient. That's generally what many humans end up eating. On carnivore, you're often 20%, 25, 30, 35%. That's pretty typical for most people on that. So protein some people would say it has unique satiety producing properties. I think up to a point it does, until you hit your protein sufficiency level. It is very much protein has that thermic effect, up to 25% of protein calories are turned into heat and they don't really get stored. So, there's some benefits from that. Most people that eat this diet just given, just normal hunger patterns, are going to end up eating about twice a day. That's just what happens over time. It's kind of funny. Most people, they go carnivore for a while, they lose their taste for chicken. They're like, I don't want chicken anymore. It's too dry. It's too, there's not enough fat.
So dry.
Most people, like I said, most people end up eating a diet that is high in red meat, whether it's beef or lamb. Some people will add some wild game meat in there. Some people will do a little bit of seafood. And I think all of that's fine, quite honestly. They're all great sources of protein. You can argue about some of the minor details, but I don't think it makes that big of a deal, to be honest. I know a lot of people get all hung up on the minutia. As a nutritionist or a dietitian, if you look at what is essential for why do humans eat in the first place, well, we need essential amino acids. There are some essential fats. We have vitamins. We have minerals. We need some energy, some either carbs or fat, and then we need water. Basically, that's why we eat. And I would argue that meat supplies all of that, certainly. Now, you could argue about certain micronutrients, vitamin C is one that always comes up because meat doesn't have a lot of vitamin C. It has a little bit, but not a lot. It doesn't have zero. It's got some. But then you get into the fact that things like the RDA, recommended daily allowances, how were they developed? Well, they're developed on a population that was eating 60% carbohydrates, grain-based diet. And they said, well, this is what appears to prevent, deficiency states. However, as it turns out, and there's a decent amount of data on the literature that depending upon the background diet, some of these micronutrient requirements can go up or down. For instance, if you're eating a diet that's high in phytic acid, which you would get from grains and legumes and things like that, then we know that our zinc requirement goes up because phytic acid prevents the absorption of zinc, so you need more zinc. So what happens if you're not eating any phytic acid? Well, then you would say, well, I need less zinc. Well, that holds up for a lot of nutrients. Like, for instance, vitamin C. I don't have scurvy. Scurvy is a deadly disease that kills people within about a month to 2 months of being deprived of vitamin C. Your teeth fall out, you get blood, you get these rashes all over your body, your joints fill up with blood, your skin falls apart, and then you die. I've been doing this diet for almost 9 years, and I don't have scurvy. In fact, I'm breaking world records as an athlete. So, clearly something's going on there. And so we know that, for instance, vitamin C and glucose look very similar molecularly, and they use the same transporters. They compete with each other. So when glucose is a little lower, you can absorb more vitamin C. Vitamin C can be recycled on the red cell. Vitamin C is crucial for carnitine metabolism. Carnitine, guess what? You get it in meat. And carnitine is actually absorbed through our gut. We have actually carnitine transporters in our gut. So, it's one of those things where you can't apply the standards of a typical omnivorous diet to a carnivore diet and expect everything to match up, because it's just a square peg in a round hole. It's just a different thing. You wouldn't expect my numbers to look exactly the same as a parakeet's number. There were different animals, different species. You would say there's some similarity there, but I think the same thing happens when you're in a little different metabolic state, when you're in a ketogenic state, when you're in a low carb state, when you're in a high protein state. I think some of the numbers are going to look a little differently. One of the common ones I see is elevations in serum creatinine. Creatinine is a proxy marker for kidney function, and it goes up. It's higher in people that work out hard, that eat high protein, that have a lot of muscle mass. And an uninformed clinician might see the creatinine going up on a carnivore diet and say, oh no, this is bad for your kidneys. We need to dial it back. And that's as far as that's as deep as they go. And you're like, wait a minute. We know the creatinine goes up when you're on a high protein diet, and that's normal. It doesn't result in harm. So you have to deal with people that are kind of, maybe a little bit ignorant to the nuance of this stuff. And I spent a lot of time, saying, hey, go get, instead of looking at creatinine, go get a cystatin C. It'll tell you the same stuff, but it won't be confounded by how much protein you're consuming. Then they do that, and it's totally normal. So anyway, some stuff there.
Mm-hmm. Yeah, there's a lot of stuff there. There's a lot of information that you're putting out there about the nutrition side of things, and you're pushing the science, and you're pushing for the science to be investigated, the research. And so, I'd like to touch on that. But I just wanted to just dive back to you're a doctor, and you're practicing medicine. And what brought you, and a long-term athlete in different disciplines, and what brought you to choosing what is considered quite an extreme dietary style? You mentioned that many people come to this, and you have got many testimonials, as we saw in your book, the Carnivore Diet, which is still the go-to resource for this eating style. But also you're regularly publishing; those are on your website, and you're regularly putting out information on testimonials of people who've come to this diet for their own health and got better. But what about your own story of coming to carnivore eating?
Well, yeah, for me, so I'm almost 60 years of age right now. And so when I was probably in my early 40s, and like you'd mentioned, I've been a lifelong athlete. I've been training since I was a 13-year-old kid in the gym lifting weights. I've been a world champion in 3 different sports now, and I continue to compete at a high level. But despite that, when I was probably 42, 43, I was, so I'll put it in maybe UK terms. I'm 6'5". I was about, at that time I was 20 some stone, something like that. I don't know if you use stones or kilograms. I was 130 kilos or something along those lines. And I needed to be. I was a world champion in the Highland Games. I was, and even at 6'5", 290 pounds, I was one of the smaller guys for that sport. They're just massive people. But I was pretty strong, so I ended up winning a world championship as a masters guy. But I was like, I just don't want to be this big anymore. It's just taking a toll on me. I probably was developing metabolic disease. I probably had sleep apnea. I had aches and pains of being in my early 40s and being an athlete throughout the years. So I decided that, hey, I'm just going to really dial in diet because I'm training already hard. I'm training extremely hard all the time, even though I was a surgeon. I mean, I fit it in. I made it a priority in my lifestyle that I would still train, even though I was busy in the operating room and in the clinic. So I lost, in a course of 3 months, I dropped, 23 kilos or 50 pounds or something like that. And I was leaner, but I was hungry and I was miserable. And I was like, I just can't do this the rest of my life. There's just no way I can stay on this diet of lean chicken breast and vegetables. And just that for me was just torture. Cause I was a guy that likes to eat. I like to eat. I'm a guy that loves to eat a lot of food and I got a big appetite. And even today I can still put it away. And so that wasn't sustainable. So I went into, this is back, 12, 14 years ago or something like that. And paleo was kind of popular at the time. So I kind of transitioned into that, bought some cookbooks, was cooking paleo, started reading about nutrition and really immersing myself in that. Eventually ended up on a low carb diet and a ketogenic diet. At that time, we had a lot of patients that were overweight, obese, that needed knee replacements. And we knew that those patients were at higher risk for complications from anesthesia, from blood clots, from infections, from poor rehab. So we tried to get those patients to lose weight prior to taking them to the operating room. And this was a community-wide thing among the local orthopedic surgeons. And there was no guidance. Well, how do you get them to lose weight? Because that's hard, right? So at that time, I was suggesting a ketogenic diet to my patients. And, like some would do it. Not a lot of them wouldn't, but some of them would. And the ones that would do it would come back. And this was interesting, really interesting to me. I would have them come back in 2 weeks and I would say, how's the diet going? And, they would say, well, I lost about 3 or 4 pounds or something. Maybe they didn't lose any weight. But the one thing that stood out to me is a lot of the patients were saying, you know what, doc, my knee doesn't hurt anymore. And I mean, their x-rays were horrible. I mean, I was going to put them on the schedule for a knee replacement, but they're like, my knee just doesn't hurt anymore. And I was like, well, if you want to stay on this diet and not have surgery, you don't need it. I mean, as far as I'm concerned, if you don't have pain, there's no benefit to you for this knee replacement, unless there was like severe deformity or something like that. But so that was kind of my aha moment to me. And then, so I just kind of dug in hard, and then I discovered this wacky group of people eating only meat, and I thought they were nuts, and the same thing that everybody thinks. But it turned out that they actually had some valid, valid insight into stuff, and the results are the results. I mean, you can't deny the results. That's all I can. If anything, I mean, if you think I'm nutty and crazy, that's fine. I get it. I would think that too if I was unexposed to this previously, but you can't ignore the results we're seeing. And I mean, you can go to my one website, carnivore.diet. There's over 1,000 testimonials that we have. I mean, and this is just the tip of the iceberg. And these are hour-long video discussions, write-ups, pictures, lab results, MRI results. I mean, it's just, we've now published several scientific papers on this. So it's changing. More people have heard about it. You heard about it. I mean, when I started this, years and years ago, when something like 99.99999% of the population thought I was nuts. Now only like 99% of the people think I'm crazy. So we're making progress here, little by little.
Little by little. And it could be that we're in a bit of an echo chamber as well, that when you are living this, breathing it, I've heard you say this is 7 days a week for you. Supporting people, putting information out there, making contact with people, talking on podcasts like this. So we may think we're reaching a great deal of people, but what I see in my practice is more people are coming to me having tried it or wanting to try it and being interested, being curious and wanting a bit of support and a bit of hand-holding with that. And it's across the demographics, really. And I see that with your testimonials that you put out there, that all sorts of different people from different walks of life, from different countries are coming to this. And like you say, the results are quite powerful, quite exciting, really. And I've had people on my podcast talking about, their style of nutrition and food changes and very pro low carb, but thinking that carnivore is crazy. And I definitely did when I first heard about it. I've heard you talking about the misconceptions and that get you shaking your head about, and you work quite hard to demystify those. So I'm wondering what are the key ones that stand out to you that you'd like to dispel? I
think there's sort of, I don't want to call it misinformation. That's kind of a goofy term these days, but I mean, there are some things like assumptions that like, if you do a carnivore diet, you must have this grass-finished beef to be healthy. That's not true. If you do a carnivore diet, you must eat all these organ meats to meet your RDs. That's also not true. If you do a carnivore diet, for a long time, you're gonna have this hypercortisol state, and you're gonna be developing all this runaway gluconeogenesis, and you therefore need to put in a bunch of fruit and carbs in later. That's also not true. At least it's not true for the vast majority of people I've ever seen. From the complete people that say don't do it at all, it's bad. I mean, these people will say that, it's going to cause you constipation. You're never going to go to the bath. That's not true at all. In fact, way back in 2017, I got 100 people to do the diet, and we literally tracked their bowel movements, and they had on average 1.2 bowel movements per day. So every 5 days they had 6 bowel movements. We actually had them track that stuff. And, the Harvard University study that came out on this in 2021 showed that about 3% of the people had some issues with constipation, which is about the general population prevalence, or it might even be lower. So it's not a real issue. It's not a real concern there. The biggest one I get is the issues around cholesterol. That's probably the biggest one, because people are worried about heart disease, which is a valid concern. It's the number one killer, right? Mm-hmm. And so the question is, a carnivore diet will make your cholesterol go higher. That is true in some instances, and is primarily driven by the so-called lipid energy model that my good friend David Feldman developed, and has, to his credit, hung in there and now published multiple studies on this. And so what it means is that if you are obese, if you are currently obese, overweight, and you go on a low-carb diet of any kind, carnivore, it certainly falls in that category, your cholesterol will probably not go up. However, if you are lean, then you're likely to see it go up higher. And it has nothing to do, or very little to do, with how much saturated fat you're eating or not eating. It mostly has to do with the way your body traffics lipids, depending upon the state of health you're in. If you're in a low-carb state and you're very lean, and you don't have a lot of stored energy in your body, your liver is going to traffic more lipid just to meet your energy needs. That's the lipid energy model, the so-called lean mass hyperresponder phenotype that they've described and have written several papers on. And that's, often what I see. I know in my own personal sense, because I'm not super lean. I'm relatively lean for my size, for sure. But I mean, as I get leaner and leaner, and part of my goals as I push towards 60 are going to be to jump high enough to dunk basketballs and do certain sprinting. I need to be a little leaner. As I get leaner and leaner, my cholesterol will go up. And I've seen it. I've observed it. I've tested my own. I see it directly correlates with how lean I am. And that's why that is. And the question is that put you at additional risk for cardiovascular disease? And the answer is, we don't know for sure, right? But what we're seeing, and this is some of the work Matt Budoff has done out at UCLA, Mortensen has done something similar in Denmark, that shows that if you are metabolically healthy in general, then that elevated cholesterol does not appear to be an additional risk for you. This is, and we can, I don't know how much time you have and how exciting or boring this stuff is for people, but the data that we're now getting seems to suggest if you're metabolically healthy, you don't have diabetes, you don't have prediabetes, you don't have hyperinsulinemia, you don't have high blood pressure, you're not too fat, you don't have a lot of inflammation, then having high cholesterol in a low carb state, and again, the other caveat there is you're in a low carb state, may not be a concern. And again, I'm going to be very careful to say may not be. We don't know 100% certainly, but the data is coming in more and more that suggests that is the case. That you're relatively protected from cardiovascular disease.
That is the biggest concern, I'd say. Echo that, and I see you talking about that. I would say you talk very moderately about this topic in general, which I think there's a view that people who follow a carnivore and promote a carnivore eating style are extreme personalities. And I would say from your talks to your presentations, I feel that you're quite moderate in how you present this and balance, particularly not making any assumptions on the long-term health gains, and really, like I've said, trying to push for the science and the research to look at this in an unbiased way, because we're kind of pushing back against decades and decades and generations of biases against eating meat, really. I've had Dave Feldman on, by the way, on the podcast, and had an awesome chat with him. He was really illuminating about that whole topic, cholesterol and the lipid hypothesis, and also discussing his film that's just come out, which is just, I can't wait to get to that and there to see that.
I saw it in Las Vegas for the premiere last
how
weekend.
Exciting.
It was nice. Yeah. I'm in a film for about a minute or so of me chatting there, but the thing, like I said, there are a lot of people, like there are some extreme people that make extreme statements in the carnivore community that I disagree with. I just say, we don't know that. I mean, anytime someone's saying, always, never, 100%, you always have to say, wait a minute, that we don't have data that supports that. The only thing I will say 100%, I'm absolutely convinced with no hesitation is that I'm wrong about something. That's the only thing I'll tell you I'm 100% sure of.
I love that.
I don't know it all. And I don't. I mean,
yeah.
I think there's a lot of things that we're starting to get, that are saying, hey, these things are likely true or often are true. But anytime like people say calories don't matter on carnivore, they just don't matter. And I'm like, well, that's not necessarily true, because I do see people that put on weight and they put on body fat while going carnivore. And I'm convinced they're eating, they're not cheating or anything. I'm convinced that's true. I mean, I think that does happen. Now, for a high percentage of the people, they don't have to count calories and they lose weight and they seem like they can eat as much as they want and they drop weight, which is cool. That's nice when it happens, and it does happen frequently. But that isn't an inviolable situation or rule. People that say that you can eat as much fat as you want, or some of these other things, like they'll say, like, I'm going to live forever because I've carnivore, I'll never get cancer, never get heart disease. Those things are just unknown as far as I'm concerned. And I think, like you said, if you ask me what I'm going to die of, and hopefully it won't be anytime soon, I will probably die of heart disease or something that everybody else dies of. I mean, I don't think it gives me some special magical properties. It might prolong my life or improve my certainly my quality of life. I know is better. I know my quality of life is good, which is what ultimately matters to me and probably should matter to everybody. You put more, instead of having more years, put more life in your years, or more years on your life, have more life in your years. And then hopefully those quality years will longer. I think I'm fairly comfortable saying that if you maintain good health, you're likely to live longer. You can always get hit by a bus or something, but and even if you don't live longer, that quality will be better spent. I mean, I met a lot of 100-year-old people as an orthopedic surgeon, and with rare exception, it was an old, skinny, demented lady in a diaper with urine, smelling of urine with a broken hip. I mean, these are most of the 100 years old I've ever met. So I'm like, yeah, I'm not too excited about that particular living in that condition. Now, if I was 100 years old and still competing in sports and athletics and agile and happy and felt good, heck yeah, sign me up for that.
So you're less about the numbers and more about the quality. And I think that's absolutely fair points. And then a lot of what you talk about is what you do, and the testimonials of many, many, many people that you have supported, or been in contact with, or studied over the years, and how well they feel on this and their improved vitality, their reduced pain, their reduced diagnoses, warding off having chronic disease, diabetes, for example. But you do talk about people testing themselves and getting them, N=1, being responsible, taking charge, taking control of their own health, and reviewing it, making sure, checking in whether this lifestyle works for them. On a personal note, I've heard you say that you have not had vegetables, at least vegetables, probably not fruit as well, for many years. I think 2016, I've heard you say, was the last time. So great.
Yeah, I mean, the last vegetable I remember having was a Brussels sprout. I had that in France.
That's what did it for you then.
Yeah. Well, no, I mean, yeah, I never really liked Brussels sprouts, but I found if you would like put them, you sear them with bacon fat and you put a little like goat cheese on there, they could be tolerable. I remember having some that prepared that way. I think it was with beets as well. I remember people eating beets and like, these beets are just awful. But if you put enough animal fat on there, you could make them palatable. Yeah, I mean, I've had some incidental vegetables. Like sometimes I'll go to a restaurant and they'll cook and they'll throw some chives on something. I'm not going to be out there like, I'm not paranoid about it. I'm not religious about it. But, I mean, for all intents and purposes, I've not had any significant vegetables in almost 9 or 10 years, I guess 9 years. I've had a few pieces of fruit here and there, but super infrequent. But yeah, my diet is, I mean, it's meat. I mean, it's for my own personal thing. And I don't usually put myself up as, I mean, I'm saying I'm an example of someone that can live without fruits and vegetables and seemingly do quite well. And there are other people certainly I could point to, but I do think that, again, you don't have to trust me. And I would encourage you not to trust me. I'm not that I'm untrustworthy, but you need to do your own research. You need to test it on yourself and see what happens. And, like I said, if you think the carnivore diet sounds crazy, you never do it, then don't do it. No, but if you're curious and you have some medical condition that you might have had for 2 or 3 decades and you're frustrated because nothing ever helps, it's certainly worth doing it for, I say ideally 3 months. That tends to be a long enough trial that you get through a transition phase. And the reason I say 3 months is because I surveyed 12,000 people doing this diet and asked them, when did they notice a significant inflection point for whatever condition? It might have been, gut issues. It might have been mental health issues. And by 3 months, the vast majority of people had noticed significant improvements.
The amounts of people who have tried something for a few days and it's not resulted in an immediate result, and then they give up or they don't get over the first hurdles, the practicalities, the difficulties. But yeah, so trying it, if you're going to try it, trying it for a period of 2 to 3 months and I like to encourage people to track as well, not just what they're eating, but those potentially symptoms, the digestive symptoms, maybe their sleep, maybe their energy levels, their satiety as well, if they can do that on notes on the phone or a piece of paper. And that really gives them a lot of intel, personal intel on how they're going. And then, potentially take some health markers, get some blood tests at your doctor beforehand, and then maybe 6 months down the line and compare. That's always good, particularly if you're trying to tackle a health problem.
Ideally, you have a physician that's familiar with low carb, and actually supportive, because one of the things, and I've seen this over and over again, and it's a little frustrating, is because I will have somebody with, say they have Crohn's disease and they're bloody diarrhea 20 times a week, and they're on all these medications, they're on these immunosuppressive drugs, and they're on these corticosteroids, and their doctors tell them they're going to have their colon cut out if things keep going like they're going. And they'll go carnivore 3 months and everything goes away. They come off all their medications. They feel wonderful. They have no more symptoms. And they'll go to the doctor and they'll tell the doctor, I'm feeling great. This is the best I feel. Well, how are you doing? I'm on this carnivore diet. And the doctor says, oh, no, that's not good for you. And then maybe they look at their cholesterol and say, oh, look, see, your cholesterol is going up. You need to stop this diet and go back on the drugs. And they do. And it's just, to me, it's kind of crazy So you got to get doctors that get it.
Which is hard.
One thing, and I don't know I don't know where your listeners are. If you're in the U.S., that's what we have with Revero. This is our company. We have doctors in basically every state that get this stuff. Many of them are carnivore. We don't put everybody on a carnivore diet, but we certainly use it when appropriate. And so you have to understand the sort of unique physiology, the expected alterations in labs, which don't necessarily represent a problem. It's just, this is the reality of this situation. So yeah, I mean, it's important to get, if you're sick and you're on medications, you need somebody that understands how to get you off those meds, how to interpret the labs correctly, and find somebody to support it. Because one of the things, and again, I talked to the survey I did, we asked them about level of support, and the people that had support of family, coworkers, friends, and most importantly, a supportive doctor, were like 30% more likely to be successful. When you are fighting against everybody's telling you don't do this and your doctor's telling you not to do it, the likelihood of your success drops significantly. And it shouldn't be that way, unfortunately.
Yes, you're right. And that support model, I think that's really, really worth mentioning, that that is when people are more successful. So imagine somebody's listening to this, they're curious, they want to get started. Can you talk me through how the steps and strategies, any tips you've got for them, and perhaps weave in the support that's available through Revero, through the company that you set up? Because over here in Western Australia and Australia, we've got Low Carb Down Under, which I work with. We've got a directory of low carb doctors, and I'm often speaking to people trying to track down a local doctor for them, but it's extremely challenging. Recently, I had lunch with a doctor that you've had on your podcast, and he's carnivore, his wife's carnivore. We had a carnivore lunch at my house, and we were discussing that he is perhaps the only carnivore doctor in the whole of the States that we know of, or carnivore supportive, and low carb supportive. It's challenging. So yeah, if you wouldn't mind, how could somebody get started, and what kind of support could they get from Revero?
Yeah. So, I mean, to get started, I think, you have to realize that obviously you want to set yourself up in the best potential situation. If you've got all these problematic foods stuck all over your house, I think you need to find a way to get rid of it. Give it to somebody, go have a party and eat it all one night, but decide you're going to stop. So you're not tempted by it, because, if you've got a plate of cookies on your counter and you walk by that 10 times throughout the day, every time you see that, you have to make a decision on that. So set yourself up with success. Talk to the people you live with and say, look, this is what I need to do. I want to try this for 2-3 months. I'd love your support in this. And most people you'll find will be helpful with that. Maybe they'll join you in that. You need to eat enough. So, I mean, this is the thing. I think, and a lot of people struggle with food addictions and cravings and things like that. And so one of the things that's going to help you is eating enough. And maybe your goal is to lose 20 pounds or 10 kilos or something like that. But before you tackle that issue, you need to tackle some of the addictive natures around ultra processed foods. And that is better tackled when you're not hungry. When you're hungry and you got all this delicious junk food, you're going to probably eat it. So make sure you're not walking around hungry all the time. So load up on lots of nutritious meats and fish and and eggs, and have those things available. Eat plenty to the point where you just don't want anything else. People ask me, how much should I eat? Eat enough so you don't want that packet of Tim Tams or, whatever. I'm just using things I know are available in Australia, or whatever, the crisps and chips and things like that. The pizzas, the MAHAs, whatever you guys call McDonald's there, the junk food, eat enough so you don't want that stuff. And then realize that even despite that, there are going to be cravings that are going to pop up day 7, day 19, day 27, whatever it might be. If you realize that cravings are often associated with hormonal surges, things like ghrelin, which often peaks, around 8 p.m. for many people, that, will drive you to want to eat these things. Give me some chocolate, give me some quick bread or carbohydrate. But that is typically short-lived. It's usually about a 30 to 45 minute cycle where these hormones will come and go. And if you realize that, hey, I don't have to fight it indefinitely. I just got to fight it for 30, 45 minutes. So it might be, what can I do for 45 minutes that'll distract myself? Can I go for a walk? Can I engage in phone, conversation? Can I distract my mind, reading, listening to music, whatever, exercise if it's appropriate? I don't think doing high intensity exercise in the middle, right before you go to bed makes sense because it's going to interrupt your sleep. But, things that are there, maybe you eat something that's appropriate, that's on your dietary plan, have something available, just the act of stretching your stomach out with fluid, like just chugging a liter of water and going for a walk. You'd be surprised how well that works for shutting down those cravings for just a short period of time that you need to. And a lot of times they feel like if I can just get from that 7 p.m. to 8:30 p.m., get ready for bedtime and you don't eat, then you're like, I can go to bed. I'm not really that super hungry. I wake up in the next morning, I'm not hungry at all because the hormone profile has changed completely. A lot of people will be amazed that they go to bed hungry. They wake up not hungry. It's like, well, I don't remember eating in the middle of the night. Why am I not hungry now? It's because the hormones have changed. So some of those things are important. I think staying on track of your hydration. When you go on a low carb diet, your insulin levels will come down most likely. And when that happens, your kidneys won't hang on to as much salt. And so you'll end up, fluid and salt, water and salt follow each other. So you'll end up relatively dehydrated, which can result in things like headaches, heart palpitations, low energy, fatigue. And so you need to stay on top of your hydration. That means enough fluid, some electrolytes perhaps. You're going to eat, like I said, you're going to have to eat enough fat to keep your energy up, right? And so, the type of fat can be important. If you're eating a lot of rendered fat, cooked fat, liquid fat, greases, butters, those things tend to not spend much time in our stomach because they're already liquefied and they end up in our intestines. And sometimes we end up, exceeding our capacity to absorb it. And then it ends up in the toilet in the form of diarrhea. And that's not fun. So you want to avoid it. So you just want to make sure the fat you get is adequate enough for your needs for the day, but also not in enough amount that you can't absorb it all. So a lot of times that initially it might mean smaller meals more frequently. Maybe you might have to eat 3 or 4 times as opposed to 2, which most people end up doing. So initially you got to have to kind of figure out that how much fat can I tolerate? How much do I need? How much of it's rendered? Those types of things. So those are some of the common issues I often see from most people starting out that can help. Having a supportive environment, of course, is super helpful because there's people that can answer questions. It's got to be quite careful. Some people just have some weird answers and I'm like, I don't know if that's going to work or not. So you have to make sure you got someone that's, I don't know, has some level of reputable knowledge here.
And Revero, is that available outside of America? How does that, if somebody was outside, would they be able to get support?
Well, okay. So, and I forgot to mention, so Revero is you get a doctor assigned to you. This is better tailored for people that are treating disease, right? And we have coaches and we have, we literally can see data being uploaded every single day from our patients. So we can make adjustments on the fly as needed. Whereas, the typical thing, you go to the doctor, he may spend 30 minutes getting to know you, tells you, go order some labs, check your labs. He, puts you on a medicine, see me in 3 months, see how you're going. That's a really inefficient way, particularly if you're, and our goal is to get people off meds. And so what we're doing is having them upload their data on a daily basis. And so we can look, and when they reach a certain threshold, we can say, hey, you know what? You don't need that blood pressure med anymore, or we can cut it back, or you don't need as much diabetic meds. We can dial that back. And then we have coaches that will literally talk to people every day if needed. We're in there so this is with Revero. This is in the U.S. Now, outside of the U.S., there are resources, like you mentioned, the Public Health Collaboration in the UK. There's a couple of organizations in Australia, South Africa has some. I'm trying to think where your audience might be. We have, Carnivore.diet, which is it's not a medical program, but it's a supportive community. I run that. I have meetings every single day. I have people from all over the world. I've had people from Botswana and South Africa and China and Japan and all over Europe and, of course, Australia and, on and on, Canada, US, of course. So those are options. So Carnivore.diet. Revero, if you're a US person that needs a doctor to oversee this stuff. And I think people that are sick, they're on multiple medications, they're better served when they have a doctor that can guide them to help come off the meds and that type of stuff. Because a lot of people, you get people that have high blood pressure and they're on all these blood pressure meds and they go carnivore, all of a sudden their blood pressure normalizes and their meds drive it even lower. And now they're in a situation where they're too low of blood pressure. Stand up, fall down, whack their head. We don't want that happening. So that's a situation where, same thing with blood glucose. You're in somebody who's on all these blood glucose lowering meds. because they're eating all these carbs, and then they go to low carb, and all of a sudden they don't, now their blood glucose is low. We got to get you off the meds. So that takes a physician to do that legally. Anyway.
Yeah, legally and safely. Since we need a bit of monitoring there, so we avoid a hypo or a problematic situation with their health. I can hear an alarm going off. It sounds to me a bit like a glucose monitor or a continuous ketone monitor. Just checking if that's what it is. For
me?
Yeah.
Yeah, I'm wearing a CGM, and my blood glucose is actually a little low right now, and that's not unusual for me. I mean, if I was in the, I can tell you what it is. My blood glucose right now is 54 milligrams per deciliter. So if I was in a normal hospital, they go, well, let's give you some sugar, start an IV, but I'm totally fine. I mean, this is because I'm probably using a lot of ketones for my energy and my brain and all those things. So yeah, it's interesting.
Yeah, it is interesting. I've just recently used a continuous ketone monitor, and that's interesting. It's amazing new technology that we're able to track our health.
Yeah, I mean, we're going to be at a point where we're going to have continuous everythings. I mean, ketones, triglycerides, insulin. I mean, all this.
Insulin.
Now the problem is it going to be information overload, and you're going to be like, oh my God, what can I do? Because if I do this, my triglycerides go up, but if I don't do this, my glucose goes up, and then my ketones go down. So I worry that information overload is going to drive people nuts and make them, because I mean, ultimately it's like, get good sleep, don't be obese, don't be weak, don't smoke, don't drink too much, eat a good healthy diet, and enjoy and get out in the sunshine and smile, and that's really what health's about. It's not about some magic perfect number. And I think people wearing continuous monitors are going to find that out. Because we have these assumptions about what's healthy, and they're like, well, wait a minute. Like for instance, glucose. We see world-class athletes while they're competing will have a blood glucose of 300, 400 milligrams per deciliter while they're competing, right? I mean, sky high, ridiculously high glucose, and yet these are some of the fittest, in shape, healthiest people on the planet. And you're like, wait a minute. Maybe in that situation it's appropriate. And so we're I think we're going to find the same thing with ketones. We're going to see the same thing with insulin and whatever match cholesterol. Like I changed my cholesterol 200 points, almost 200 points in 18 hours, right? Just by fasting and exercising, because it was sitting there at a normal, like I'm going to use US units, and you can divide it by 38 if you want to calculate the millimolar units or whatever. It was 154 total cholesterol, totally fine. No one would ever bat an eye. That's a good number. I went 18 hours without eating, and I worked out, checked it again, and it was 345. So that was a 189 point swing in the course of 18 hours. And if I had gone to the doctor on the Sunday, they would have said, good job, no problem. But if I went on Monday, they said, oh my God, you need to be on statins, and you need to maybe get a cardiology consult, and worked up for familial hypercholesterolemia and all this stuff, because we just don't understand how dynamic these numbers are. And so what's not dynamic is how much belly fat I have, It ain't going, I'm not going around with a big beer belly one day and a six pack the next day. That didn't happen. So that indicates what's going on chronically. And I think those things are a more valid metric to be focusing on.
Yeah. And also bringing it back to feeling good and taking on board these changes, living life well. You've made a comment at the beginning about how you've always, even though you are father, a busy surgeon, quite a high pressure work, also an athlete, you made time for working out, keeping your body in shape. You prioritized it. And the word is prioritized that you used. You made time. And I think that's where this comes down to getting information from podcasts like this one, and information from your site and your different social feeds, and maybe your book as well, and then making it adaptable and flexible to fit in with your life, and not overly crunching numbers and thinking and worrying and copying. But that said, I know people will be interested in what you eat in a day. I'm interested in what you eat, although we do see a lot of what you eat. You happily tuck in during while looking at other videos. And the other side of that, I'm curious, because I'm a mum and life is not perfect with what's being thrown at kids. And you did adapt to this diet when your children were probably older, or your son was older. So how did it fit in? So what do you eat, and how did you make it work as a dad?
Yeah, I've got 4 kids, and I eat my personal food. I mean, I don't necessarily push that on my family and my kids. They eat a lot of meat. They're not strict carnivores by any stretch. They eat a wide variety of foods, but we know the focus is high quality protein, eat a lot of meat as a first thing they do. And then beyond that, they have a little more flexibility. For myself, I typically eat 2 meals a day. I usually eat my first meal somewhere around 11 a.m., depending. I usually have meetings in the morning and consultations I do, and then I usually fit in a meal right there. It's usually about 1 kilogram of steak. That's typically what I eat for my first meal of the day, 2 pounds or something like that. And then from there, I will usually eat a second meal around 5 to 6 p.m. It's usually something smaller, maybe another half a kilogram or 1 pound. I usually eat about a total of like 3 pounds of meat a day. Now, again, my statistics, I'm 6'5". I'm about 250 pounds. I'm a big boy. I'm just a big man. So that's what keeps me kind of, and I'm actually losing weight on that. That is my current, because I'm trying to lean down a little bit. Now, if I'm weight stable, I probably eat around 2 kilograms a day, maybe slightly less. Keeps me kind of weight stable at about 250 pounds. In order for me to gain weight, I've got to add another half to full kilo on top of that, and assuming I want to gain muscle, which is, I don't want to gain a bunch of fat. There's no real value in me adding a bunch of fat. That's what I've been doing. I mean, sometimes I'll include some eggs. Like instead of I might use, a dozen eggs to replace, 500 grams of meat or something like that. That's roughly, a dozen eggs get you around 70 grams of protein, 72 grams. I think there's 6 grams per egg, something like that, depending on the size of the egg. But that's typically, I definitely consume red meat every single day with rare exception. Maybe I might not eat it. I might fast occasionally if I'm on a long traveling day, like I'm flying internationally. I just don't eat because I'm just sitting there. I'm not expending any. I'm just literally just sitting there, not doing anything. So I'll often just not eat. Yeah, I usually exercise pretty much every day. I'll take a day off here and there. I've actually taken a little more day off more recently because of the intensity of my training has gone up quite a bit as I focus on high intense sprinting. So I usually have one recovery day. Often it's Sunday. So yesterday was my day off. Today I went and ran some sprints. Yeah, but I don't have a very exciting diet. I usually drink water. Sometimes I'll add some electrolyte to the water, and I usually just salt for seasoning. And it's kind of weird. The longer I've been doing this, the less variety I seem to need. I've gotten to where I'm literally like my dogs. My dogs just eat meat, and they're very happy. They're very excited. They jump up and down, and they drool, and they're super excited when they're mealtime. And I'm kind of like them. I'm like, when my steak's cooking, I'm like, I can literally feel my mouth getting wet. I'm ready for this stuff. And it's I know it seems crazy, but the longer you do it, the less excited you are about all this other stuff. I literally walk through grocery stores. I just don't even, they might as well be selling rocks. It's like, I have no desire to eat that stuff. It's not that I don't think those things still taste good. I hear people in carnivore saying, "Oh, I'm so disgusted at chocolate cake," and I'm like, that stuff still tastes pretty good to me, And like I said, very rarely, and we're talking once, twice a year, I'll have something like that. But I don't want it. That's a weird thing. I don't really crave it like I used to. Like in a past life, I was a guy that, would eat my dinner. And it'd usually be like 2 entrees. It might be 2 or 3 appetizers. And then come time for dessert. And remember, I'm eating 8,000 calories a day back when I was, close to 300 pounds. And I would that dessert, gosh, I can't decide between the red velvet cake and the key lime pie or the cheesecake. Just bring them all. I'll just eat them all.
Wow. That guy.
I would just, I'd walk out of a restaurant with, 2 entrees, 3 entrees, a couple desserts, and a couple appetizers. Typical. That was not unusual for me. I was in a restaurant in Italy one time in Venice, And, behind, the cathedral there? Is it St. Mark's Cathedral? I think I remember
St.
the
Mark's
name of it.
Square.
But anyway, I went to a restaurant and I don't know how many courses. I probably had 30 courses. It was so good. And I literally, when I got up, the entire kitchen staff came up and gave me a standing ovation. I can just put away food.
That's crazy. That's actually quite crazy.
But now I literally, if I want to eat less, it's not a big stress. It's weird how carnivores it'll let you do what you want to do in many ways. At least it is for me.
And I hear that a lot. I actually got a phone message left from a client yesterday who's upped her protein. She's in her 70s, and she just wanted to say that she's weight is easily slipping off and she hasn't been able to shift it for 10, 15 years. It's just been going up. Nothing's worked. And she feels satisfied and happy with her food. So those cravings you're talking about, it's absolutely wonderful when those shopping aisles that you were talking about just don't speak to you in that same way. I definitely had sweet cravings before low carb, before keto diet, before increasing my protein, and I didn't even know I had them. So that would have continued like everybody else over decades, and then the weight would have started going on. And I luckily came to learn about this lifestyle beforehand through helping my children with their health. You mentioned that your children are not carnivores, definitely not strict carnivores, but higher protein. I'd say the same for my children. My daughter's in ketosis most of the time, and my son is high protein, but definitely a lot of flexibility around being a child and going out and experimenting and trying things that I'd rather they didn't, but it's a natural part of lifestyle, unfortunately. But I just wanted to get your take on, I did have Dr. Anthony Chaffee and we talked carnivore, a lot of carnivore, and a lot of our discussion was around carnivore for children and whether that was a good idea. I just wanted to get your take on whether children would benefit, whether you think it's a good option, whether you think it's a safe option.
I think it's generally a safe option. Whether it's a necessary option, I would say that depends. I think kids with a disease, like you had a young kid diagnosed with Crohn's disease or type 1 diabetes or some other issue, then yes, that would probably say that would be a good time to utilize this. Kids have to grow. This is their job. When they're real little, they're growing at a really rapid rate. Their brain is growing. Most of that happens by age of 6. But our brains are still growing until we're about 25. So it's real important that those kids get adequate energy. You look at breast milk. Breast milk is not low carb. It's high fat, high carb, moderate protein. There's not all that much protein in breast milk, but we're primarily growing internal organs, a central nervous system, a brain. The most rapid brain growth is occurring in uterus, but then after that, the first couple of years of life, and then up to about age 6. I think kids should definitely be eating a lot of animal proteins and fats. I think eggs and meats and things like that, dairy products, if they tolerate that, are great sources of protein, fats, fat soluble vitamins. Those things are super incredibly important. Kids should load up on that. That's if you're a parent of a child or multiple kids, a parenting hack is to load those kids up in the morning on animal fats and protein, and they're not going to be pestering you about food for the rest of the day. Because when you have 4 kids and they're all hungry at different times, you spend your whole day cooking, or or handing out snacks or garbage, which you don't want to do. So, I would get them all around the breakfast table Saturday morning. Said, "Hey guys, I made you some pancakes, carnivore pancakes. I've made you out of eggs and cheese and and whatever, maybe top it with whipped cream and bacon and eggs and some meat." And I'd load them up on that till they were like, "I can't eat anymore." And I would not hear from those kids until middle of the afternoon, which is nice. It gives you a little more time to sort of. But my kids are all tall. My daughters are 5'9", my son's 6'4", so they're growing well. But again, that's something you want to make sure they're staying on the growth curve, and growing well and developing well. And I think animal fats and animal proteins are certainly part of that. But energy in general, you got to make sure they have plenty of energy. And it can be hard to get enough energy on carnivore unless you really like it and you're motivated to eat it. But some kids they'd rather have a piece of fruit or something like that. That's fine too for most kids, I think.
Interesting points. And your points about getting full on protein in the morning, I love that as a tip for most of my clients, but brilliant tip for children, growing children, to meet their needs and get that satiety and stop them snacking and craving. It really heads off the junk food cravings.
Yeah, I mean, obviously, you got to grow, you got to feed kids, they got to get adequate nutrition. But when I was a kid growing up, and I grew up in the 1970s, and I'd come home from school, I'd get home, 3:00 or whatever, 3:30. I'd say, "Hey, Mom, I'm hungry." And Mom would say, "Well, dinner's at 6, just go run around and play." And then when dinner came, I ate more because I was hungry. I just waited. And so nowadays, okay, go get a granola bar. Here's a juice
Absolutely,
cup.
you're right. I remember that too.
Garbage, right? Yeah. So your kid's not going to die if he's hungry for an hour. I mean, it's fine. They're totally fine.
I've actually heard you say that in a podcast chat. Somebody was asking how to improve their child's nutrition, or the podcast interview were asking you about children's nutrition and how to get them, higher protein. And you did talk about stretching that. Hunger is a powerful motivator, is what you said. And I agree. Yeah. And it's something we don't often associate now with childhood. It's a constant snack fest the whole way through.
Yeah, we've traded out convenience for good health. I mean, the convenience aspect of it. Yeah, it's convenient. I mean, I saw a survey a few years ago on, I think it was might have been millennials or Generation Z, and they said they're gravitating away from cereal. And I thought, well, yeah, cereal's kind of empty calories. It's not that good. I mean, it's fortified because they have to afford it because it's garbage. But the reason wasn't that. It wasn't because they were conscious of health. It was because it was too much work. Because they've got to rinse a dish, they've got to get milk, and they'd rather just open a package and chew up a candy bar, or a healthy bar, or whatever. You can put health around that in quotes, because it's quicker and easier. And so even cereal is too much inconvenience for some people. Not alone, sitting down and cooking up some eggs and things like that, which is,
sounds
that's
radical.
a lost skill, unfortunately.
Yeah.
So you got to teach your kids how to cook. Gosh, if you don't know how to cook yourself, you need to figure it out and then pass it on to your kids.
Absolutely. It's a life skill it's one of the best life skills we could pass on to them to help them look after themselves and protect themselves as they grow. I've taken up a lot of your time, and I really, really appreciate this conversation and your insights. And for somebody who you say 99.9% thought you were crazy, now 99% think you're crazy, I find you very rational, measured and I've just said it, insightful. Very. What I wanted to ask to close, and as well, if you've got any points you'd like to add as well that we haven't covered, but just to close, I was wondering on that point of 99% of people thinking this is still crazy. When do you think we'll get to the point where mainstream accept meat-based eating as a viable option?
Well, I do think that part of it depends upon getting some good studies done, because obviously I cannot tell you how many success stories, anecdotes I've had. They're into the thousands at this point. And so for some people, that's enough. They see somebody that's doing things, have the exact same issue they have. They've tried everything else. They've exhausted all the balanced diet mantra and the drugs and all the stuff, and they haven't, and they're just willing to try it. So we've got that, certainly those people that are kind of desperate, and certainly that's helped a lot of those people. We have, like I said, we've got case series that have come out on IBD, inflammatory bowel disease, on depression, anxiety, on some certain autoimmune conditions, anorexia, believe it or not. It responds quite well to this. We have more that are going to come out. Studies on multiple sclerosis and psoriasis and rheumatoid arthritis are all in the works. We need to get some randomized control trials and intervention trials done. Those are being talked about. I'm behind the scenes helping to put some of those together, trying to get it funded, which is always the hardest part, is getting somebody to put up the money for this stuff because they cost quite a bit. I think once we get more of those things in place, hopefully with the reorganization of the National Institute of Health, with Jay Bhattacharya taking that over, hopefully if he gets confirmed, I think he will, pretty easily, we might see more money directed towards studies like this. I think they need to be done, because if we're just going to assume that the answer to everything is to throw more drugs at it, that has not served the population. We've been doing that for 50 years, and chronic disease is not going away. If anything, it produces more chronic disease. We just have more pills to manage the symptoms. So hopefully there'll be an appetite to say, hey, how do we as Kennedy has said, why is everybody sick? Why don't we figure out why that is? And then if we can figure out why, maybe things like a carnivore diet will be part of the solution. And, I think a lot of people out there, and again, I know this is the U.S. stuff, but this Make America Healthy Again is going to depend upon Americans wanting to be healthy. And I think we're seeing that. We're seeing some level of people waking up and saying, look, I'm just, we've been poisoned by our food supply, more or less for the last several decades. We got to change that. And so I do think that in the next couple of years, we're going to have a big shift. I mean, I'm seeing it already. I mean, we're already seeing places like in the UK, where you're from originally, and other European nations are now, for the first time ever, the first time in the history of doing surveys on this, are stating that they are intentionally going to be eating more things like red meat. And the reason they're doing it is because they believe it to be more healthful. So I do think there is a sort of a shift in the cultural ideology, if you will, of what is actually healthy now. And so I think we're seeing those shifts making place. And I think part of it is because the work of what we've been doing is saying, look, and it's, like I said, you may think carnivore is crazy or not necessary or overly restrictive, but when you see people that eat nothing but meat and they clearly get healthier, what does that say about meat? I think people are realizing that, maybe meat's not the thing we need to vilify and demonize, as we couch it in the context of a standard American junk food diet of hamburgers and French fries and Coca-Colas and saying that's what meat does to you. No, it's all this other garbage that we're adding to it.
I feel quite hopeful and where America goes in the next few years with this change in administration, this push.
Yeah, a lot of the rest of the world will follow that.
We'll follow.
For sure.
We absolutely always do. I mean, we've followed you down into chronic disease. Thanks very much. And weight gain and pharma, huge, incredible amounts of pharma interventions. And then a pill to rectify the harm of that last pill. But it's fascinating now to see at top level in America genuine discussions about what's actually behind this, because the public are sick of it. I think they do want to be well, and I think they are finding out information about alternative viable options for their health from people like you, and not necessarily from the mainstream physicians and in institutions. So there's a lack of trust, and then we see it with the channels and the groups that you're putting together. People are coming to this themselves. So I think there'll be a groundswell of public changing their diet and moving over to this first. But where would you like people to reach out to you? You've mentioned a couple of your websites, for instance. Is that how you like people to get in contact? If you want to just mention the different places people can follow you.
Like I said, Revero is where I'm trying to direct most people right now. Obviously, the book, The Carnivore Diet, if you want a very good basic understanding of this stuff in more detail, that's out there. It's on Amazon. I think it's available throughout the world. It's in several languages. German and Polish and Hungarian and Japanese. And for some weird reason, I don't think it's been translated into Spanish or French yet. And it kind of drives me a little crazy because I'm like, there's a heck of a lot more people that speak Spanish than speak Hungarian, but or Polish. But not that there's anything wrong with Polish people and Hungarians getting this, but interestingly, to my knowledge, I have not translated it into Spanish yet. Hopefully it'll happen soon.
And it might be getting easier. But it's a great resource, that book. It's quite comprehensive, and there's lots of stories as well, personal stories, which just help, I think, people to understand and illuminate and how it works for other people and what benefits that they've got. Thank you again so much for spending this time with me and all the information you put out there. I follow, and I feel like it's a great resource. And, I'm having people who have come to me for years who mention your name as an inspiration to them and have helped them. So I believe you've helped so many people, as you've mentioned with the testimonials, and you're going to go on to continue to help people. So thank you so much, Shawn.
Yeah, likewise, Claire. Thanks for having the open-mindedness to go from a nutrition background to say, hey, this is a valid approach for many people. So awesome. Thanks. Keep doing what you're doing.
Thank you.
Thank you for watching. If you like this video, please make sure to subscribe. This really helps us to be able to create more content.